District, and Judge Canales will be with us via live streaming, and we're live streaming and able to do that. And before we get started, share with you that great sadness that we inform you that the passing events of COVID-19 yesterday of COVID-19. Vince was an employee here at the city. Vince was graduated here at the city high school. Graduated from King High School for 14 years. He worked in the utilities. He worked as a utility tech 3 in the master meter shop, and was a valued member of the team, and will be greatly missed. Before he came ill, he had been selected as a construction inspector for engineering services. So we'd ask you to keep Vince's family and friends in your thoughts and prayers in this difficult time as they're dealing with his passing. Again, it just reminds us that this is a serious disease that we're fighting, and we need to do everything we can to make sure that we keep ourselves, our family and friends and loved ones protected from exposures, and so we stress again to wear the mask, wash your hands, do what's necessary to protect you and your family and loved ones. So it's real, but we're continuing to work as a community together, and that's a great thing. I believe, and people that I've talked with, as the numbers will fluctuate from day to day, the fluctuations appear to be getting smaller and seem to be leveling out on your 7-day average, depending on when we get reports back. So I think we're on the right track. It's beginning to hopefully see a decline. I don't know that it's going to be real fast, but as long as it maintains that decline direction, then I think we're all pleased with that. We'd like to see it faster, obviously, but we want to continue to do that. So I'd like to ask Annette Rodriguez to come up now and give us the information and the data that she has from the Health District. And again, remind each one to pay attention to all that you do in your surroundings. Keep yourself safe and keep others safe. So, Annette.
Con mucho pesar les informamos el fallecimiento del señor Vince Buentello de COVID-19. Vince se graduó en King High School y fue empleado de la ciudad por 14 años. Trabajó en el Departamento de Servicios Públicos, un miembro muy valioso de nuestro equipo. Antes de enfermarse, Vince había sido seleccionado como inspector de construcción para el Departamento de Ingeniería. Por favor, mantengamos a su familia y amigos en nuestras oraciones. Esta noticia nos recuerda lo triste de esta enfermedad. Sigan las recomendaciones de usar el cubrebocas, lavarse las manos y mantener el distanciamiento social.
Good afternoon, Annette Rodriguez, Public Health Director. So I'm going to go over the statistics with you first for City Manager Zanoni. So the Nueces County, the daily COVID-19 cases. So today you're going to see 249 cases that we reported for today. If you look at the weekend prior to today, Saturday and Sunday, we always seem to have a little lower statistics on those days, and that could be just because, you know, it's the weekend, so there's less reporting maybe from the hospitals. And so the weekend prior to that, on 7/26 and 7/25, 95 and 239. So it's kind of the same trend. So the numbers 238 and 249 look a little better than they did the prior week when we were in the 300s, but we still need to get them lower than that so we can actually try to get rid of COVID-19 completely. Next slide. So this is the circle, and so this is the one that has the active cases as well as the recovered cases. And you see 8,147 active cases, 4,703, or 57% have recovered from the total number of cases. Our total cases just went over 12,000 to 13,062 with our new cases today. and we're at 212 for total deaths. Also for the recovered, we have people at the health department that actually call individuals to find out how they're recovered. July 17, CDC changed their guidelines where you could recover in as short a period as 10 days if your symptoms were improving and you had 24 hours with no fever without taking fever-reducing medication, and you'd been in isolation for at least the 10 days. You could recover and go back to work on day 11. So, next slide. So here we actually have the hospitalized patients, and if you'll look for today, 332 compared to 329. So some of these patients are in med-surg and some of them are in ICU, but it's a total combined number of 332. So we know that sometimes while the number decreases, it could be attributed to the people that we've lost from the disease, or it could be from people that have recovered from the disease. But we also have to consider that people get admitted to the hospital when people get discharged. Next slide. This slide actually shows the number in the ICU. So from the slide previous, the 332, 131 of them are actually in the ICU. The problem with the number being so high for ICU patients is that many of those individuals have had to be put on ventilators, and people that are put on ventilators don't always have good outcomes. So many of those people on ventilators will end up succumbing to the disease. And so we don't like to see high numbers for the ICU. So, but the trend does look like from 157 to the last few days, we're down to 129, 130, 131. So the trend is coming down. Next slide. And this one just shows the total deaths, but if you'll see where we started taking that turn around June 30th, definitely in July, the upward trend. So for the whole month of July, we've had 9,900 cases. If you look at those cases and you consider if we just had to notify 10 people from each case that they came in contact with, most of them actually come in contact with more than 10 people, closer to 15 or 20 people. For 10 people, that would be 100,000 people for the month of July that we've actually placed in quarantine for those 9,900 cases. Next slide. And this last one is the daily COVID-19 cases, and it shows a 7-day average. So if you'll look at the 7-day average from July 27th to August 3rd, you see the downward trend. And that's what we want to continue seeing, a downward trend all the way till we get down to 0. That's the goal, not just for Nueces County, but for the state of Texas and across the world. Now I'm going to turn pages a little bit, if you will. I'm going to talk a little bit about some of the things that are going on at the health district. Before I start, I'd like to say our sincerest condolences go out to the 8 families of the COVID-19 patients who we lost today, as well as the families of the other deceased 19 patients over the weekend. And we did have a drive-through today, and we did have 68 people that went through the drive-through, and 10 of them were positive for a percent positivity of 16%. So I'm going to talk a little bit about the power of wearing a mask. Imagine you went to a hair salon and your hairstylist had symptoms of COVID-19, but you did not develop any symptoms from your hairstylist. For over 100 people in Missouri, this was not an imaginary scenario. This actually happened to them. On May 12th, a hairstylist at a salon in Springfield, Missouri, developed respiratory symptoms and continued to work with clients for 8 days until the stylist received a confirmation positive COVID-19 test. Another hairstylist who was exposed to the first hairstylist developed symptoms 3 days after the first hairstylist became symptomatic. Both stylists interacted with each other without wearing masks while taking a break between clients. The second hairstylist worked for 5 days while symptomatic before self-isolating and seeking COVID-19 testing. Other stylists who worked in the salon were quarantined and monitored for 14 days after their last exposure to the other two stylists. None of these stylists reported any COVID-19 symptoms. A total of 139 clients were directly serviced by both of these hairstylists from the time they developed symptoms to the time they left the salon. None of these clients or other close contacts developed any symptoms from exposure to the two stylists. All the clients were offered testing 5 days after exposure. Overall, 67 clients volunteered to be tested, and 72 refused. All 67 that were tested received negative results. All the stylists in the salon and the clients wore some type of a face covering to comply with the City of Springfield mask ordinance. The ordinance included the use of face coverings for employees and clients when social distancing could not be followed. This situation could have turned out very different. The stylists and clients obeyed the city ordinance and wore masks when interacting with each other. Just imagine what could have happened if no masks were worn. Instead of one stylist being infected, there could have been an outbreak of over 139 people infected if they had not been wearing their mask. This is a real situation to illustrate the power of wearing a mask. On July 2nd, the governor of Texas issued an executive order stating that every person in Texas shall wear a face covering over their nose and mouth when inside a commercial entity or other building space open to the public, or when in an outdoor public space whenever it is not feasible to maintain the 6 foot of social distancing from another person not living in the same household. The order also contains exceptions, and I'm going to tell you what these exceptions are now, and they're also up on the slide. They are: any person younger than 10 years of age does not have to wear that mask. Any person with a medical condition or disability that prevents wearing a face covering. A person who is eating or drinking in a restaurant does not have to wear the mask. If you're exercising outdoors, you do not have to wear a mask. If you're driving alone in a car, if you're obtaining a service that requires temporarily removing the face covering. If you're swimming, you don't have to wear a mask. If you're voting, you don't have to wear the mask. Also attending a religious services or giving a speech. It's still recommended to wear the mask, but it is an exception. This order does not pertain to persons living in counties that meet the criteria for minimal COVID-19 cases. There's also the violation of not wearing a mask. So a first-time violator will receive a verbal or a written warning. A second-time violator will receive a fine not to exceed $250. Each violation thereafter will be a fine not to exceed $250 per violation. The complete document can be found at www.cctexas.com/coronavirus. All of that is said to be able to tell you the importance of wearing a mask, especially as we try to mitigate the spread of COVID-19, as we try to reopen the schools safely, not only to the administrators and teachers and faculty, but also to the students attending these schools. So, I will now allow her to translate, and then the judge will present after that. Thank you.
Permítame empezar con las estadísticas del COVID para hoy, agosto 4. En las últimas 24 horas se han reportado 249 casos confirmados por el coronavirus. 4.703 pacientes se han recuperado por completo, 332 continúan en el hospital, 131 están en la unidad de cuidados intensivos. Hoy se reportan 8 fallecimientos. A la fecha, los fallecimientos totalizan 212 personas. Nuestro más sincero pésame para las familias de las 8 personas fallecidas, así también a las familias de los otros pacientes fallecidos durante el fin de semana. Hoy quiero presentarles un ejemplo ocurrido en Springfield, Missouri. El 12 de mayo, un estilista en un salón desarrolló síntomas respiratorios y continuó trabajando hasta que recibió prueba positiva de COVID-19. Otro estilista del mismo salón desarrolló síntomas 3 días después. Ambos estilistas interactuaron entre sí sin usar máscaras. El segundo estilista trabajó durante 5 días sintomático antes de autoaislarse y buscar la prueba COVID-19. Ambos estilistas atendieron directamente un total de 139 clientes. A todos los clientes se les ofrecieron pruebas 5 días después de la exposición. En general, el 48% de los clientes se hicieron la prueba y salieron negativos. Esta situación podría haber resultado muy diferente. Los estilistas y clientes sí obedecieron la ordenanza de la ciudad y usaron una máscara al interactuar entre ellos. Imagínense lo que podía haber sucedido si no se usara la cobertura facial. El 2 de julio, el gobernador de Texas emitió una orden ejecutiva que establece que toda persona en Texas deberá cubrirse la cara y la nariz cuando esté dentro de una entidad comercial o algún otro espacio abierto al público o cuando esté en un público al aire libre. Un infractor por primera vez recibirá una advertencia verbal o escrita. Claro que esta orden tiene excepciones: menores de 10 años, alguna condición que prevenga usar cubrebocas, comer, beber en un restaurante, ejercicios al aire libre, manejando solo o con personas de su hogar, nadando, si va a votar, atendiendo servicios religiosos o dando un discurso. Como venía diciendo, un infractor por primera vez recibirá una advertencia verbal o escrita. Un infractor por segunda vez recibirá una multa que no excederá los $250. Cada infracción posterior será una multa que no excederá los $250 por infracción. El documento completo se puede encontrar en www.cctexas.com/coronavirus.
Nueces County Judge. Want to make sure I'm getting a good signal and thumbs up here, so I'll just wait just a minute for somebody to give me the all good. I'm coming to you today in a different way from my home, and this is the second time that I find myself in isolation for having a direct contact with someone who was diagnosed COVID-19 positive since this pandemic began. And with the exposure to my fellow county employee who was working side by side with me in our emergency operations center during Hurricane Hannah, I, along with other emergency operation ride-out team members, learned of this particular exposure on Sunday. We were tested on Monday, and I'm really happy to report that I tested negative, and all the county employees that served with us on the ride-out team that particular weekend all tested negative. And so just in case anybody's wondering when we'll be back outside of quarantine, my last exposure to this particular individual was a week prior. So now that we are already Tuesday, I anticipate that I will be back in the office at the county courthouse on Monday, August the 10th, and I'll be working from home until then. It's an opportunity that gives me, technology gives me the opportunity to be able to continue our press briefings. And for the media, I will also be available to answer your questions via WebEx or any other forum that you might reach me on. And so I mention all of this background as to what I'm doing not there with you and why I'm here, because I believe it to be very, very relevant. It's relevant as how we deal with coronavirus as a state and as a county and as a city. And clearly the battling the coronavirus pandemic is very personal to so many of us. And it affects us. It affects us how we work. It affects how we interact with our family members, and it affects our personal relationships. And so I just wanted to make certain that everybody on my county ride-out team know that there are risks that we take when we become first responders, when we wear those different hats. And I want to say thank you for putting yourself in harm's way. Thank you for being patient in this quarantine. Thank you for getting tested and making sure that we keep others safe and that we set the tone, the example for leadership. So I'd like to address a few things with you today that we can focus on. And I think that it's really important to understand what we can and what we can't do. And so what we can and can't do, quite frankly, is driving what we are and what we are not doing. Let me say that again, because I really like this line, and I think it's an important one to this conversation that we have daily. So there are things that we can and can't do, and these are the things that are driving what we are and what we are not doing. And I want to start with some basic facts that are undisputable. We do not have a cure yet for COVID-19. And COVID-19 is the disease at hand that is caused by this particular coronavirus. And we do not have a vaccine yet, even though we're praying for one every day. And we seem to be making great strides in this country and around the world. We're even in human trials. And so while we are very optimistic about our future for a vaccine, we do not have one yet that prevents you or I from getting COVID-19 if you're exposed to this coronavirus. And we don't have a perfect, effective medical treatment to treat coronavirus. And this probably is one of the things that makes it the most difficult of diseases, is that there are many diseases we don't have a cure for, like cancer. And there are many diseases that we don't have a vaccine for. But most diseases, we have some effective medical treatments. And this is one of the things that really kind of drives everybody crazy, is that we have some promising treatments. And you've heard me talk about the drug remdesivir that we are constantly pursuing here through our portals at the Emergency Operations Center to try to get the hospitals through the proper requests to get them the medicines that they need. And you've heard me talk about convalescent plasma, and I don't want you to forget about how important that is. As we start a new week, I'm always reminded that I want all of us who know a survivor to make certain that they give the gift of life and tell them about their donation and what it can do for 2 people in the hospital. Tell them to visit the coastalbedbloodcenter.org and make an appointment after their 14th day and of their quarantine, and make sure that they've fully recovered. But when it's time, they can give that gift of life. And so we've talked about plasma and remdesivir, but none of these have really progressed to this wonderful moment where we say, if you're hospitalized, we have the perfect treatment for you. We do everything we can in our hospitals to make certain that we can provide for the best medical treatment. But these are the things that are difficult. But there are things that we can do, and I would like to address some of those. We can treat some of the symptoms, and we can help the body possibly respond in that way. We can hopefully give supplemental oxygen. For some of those folks that wind up in ICU, we can provide ventilators. We might be able to do a variety of treatments that even include IV medication, steroids, and the like, anticoagulants. But this might mean treating other underlying conditions so the body can fight. And I remind you about all of these things because early on we talked about how we were going to flatten this curve together. Everybody talked about this curve, and how important it was to flatten it. And it was a strategy of our entire country to do so. And the reason that we said that we wanted to do this is that we didn't want to have a sudden spike in cases that overwhelmed our ability to handle those that needed to be hospitalized. Well, I want you to know that what we have seen this summer, and I'm so sorry that it happened during the summer so full of life, and when everybody wants to get outside and spend time with their families. We actually run our entire work calendar around our family summer vacations, don't we? And how cruel it has been to have this type of disease hit us impactfully when we wanted to spend time with our family. But nevertheless, this spike happened in our community in the summer. It overwhelmed our hospitals and our medical professionals. And our ability to handle those who needed to be hospitalized was greatly challenged. And I know this firsthand because we were the ones involved for the city and the county in making sure, along with our regional advisory council, that we requested, demanded, pleaded, begged to make sure we got all the staff that we needed to come into our hospitals because it was that bad. Because without that staff, we would not be able to treat those that were hospitalized. And so this is why we have these mitigation factors in place that I want to address with you. So let me go back over that. The goal was, what can we do? I told you about the things we can't control. We cannot control that this is a virus that's highly contagious. We cannot control there is no vaccine or no real remedy. We do the best we can, and the doctors do the best they can, creating the treatments that they believe could provide some benefit. But there are things that we can do to flatten that curve, because we don't want to see us the way we were just 2 weeks ago, are some of the following. The governor's orders on facial coverings and the governor's orders on bars and restaurants, that is the 50% rule and the closure of bars, have helped keep our cases down in Texas and indeed in Nueces County. The orders that I put into place prohibiting vehicular access to the beach was one way of reducing overwhelming crowds that we saw on Memorial Day that led to the increased transmission of the virus. And the individual actions of those that do all of those good things, like washing hands and wearing masks and maintaining social distancing, avoiding big reunions and crowds, all also are actions to keep our cases down. So the cumulative effect of the things that we can do, those actions are making a difference. You saw the curves just a moment ago. You saw how we had a straight up roller coaster spike, and now we have begun to move in a downward, slow slope. And our goal is to take that roller coaster all the way down. That is the goal. And trust me, it gives me zero. In fact, it's on the negative Richter scale of pleasure to do any action that takes away your fun, your vacation, your ability to access places. It is the worst feeling in the world to be able to say, I must restrict. But what I know is that these actions are the actions that are working. These are the actions that are taking our spike down. And in 2 weeks, we will be in a better position than we are today if these actions continue and we all do our part. The other part of the graph that usually everybody talks about represents this capacity in our healthcare system. And there are things that I have said that we need to do to raise the bar. And I know I'm talking a little slower today, but I'm mindful that I'm on a different medium. But I want to share with you a huge victory that I think is happening in our community, because I'm ready to ease our pain as quickly as possible. And so in order to do that, I'm trying to prepare our community for what is certainly going to be another wave in the fall. And this is what we've done. We have welcomed members from the Army's Urban Medical Task Force to augment our local healthcare professionals. And I'm going to keep on asking for those extensions to be made to keep them here, these medical healthcare professionals, for as long as necessary, because that's how we get more hospital beds in our hospitals. It's not like just magically we all have new nurses and new doctors appear. They have come from the outside in. And because of that capacity, you and I get to still go to a restaurant and be able to enjoy being outdoors and being able to enjoy all of the freedoms that we do have. But there is a checks and balances. And so being able to staff those hospital beds that we've put online makes it less critical for our healthcare professionals to deal with the crisis that lies before them. And we've created with partnerships the ability to host an alternate care site. And this site will allow us to provide care for up to 50 new beds, people who will need supplemental medical care. And these are all new beds that will be put online that we are working with our partners in this community. And I can't tell you how important it is to me to be able to have this type of relationship within the healthcare community, because they recognize that we don't have enough if a new surge comes upon us. And to be able to create that insurance for us is so comforting. And so this week, we also stood up and are standing up our COVID clinic. And this allows us to examine early intervention for those people who test positive for coronavirus. And when all of these things are in play, it does allow those of us who have to make these difficult decisions to be able to say that we are doing everything we can, everything that's in our power to reduce coronavirus in our community. And by having this clinic, we're going to be able to teach people how to monitor their health and how to isolate at home properly and how to look for early signs before they become too ill. And we can get them a better outcome, which will prevent more hospitalizations. And finally, and I think this is going to be probably the most important to all of our futures, is we're going to bring all of this together under a case management system, which will allow our healthcare providers to spot trends and to track patients better. It will allow those who test positive to self-report their symptoms and vital signs, and it will allow us to use our resources more effectively and efficiently. It means getting people the right treatment earlier, and it means getting their symptoms before they get spiraled out of control. And all of this adds to our capacity for better health in our community. And that's why we're working so hard to do it all. Because if all the tools you have is to close an access road, I agree with all of you that hate it. That's not going to work. That's not going to make the difference. But when we can combine restricting large crowds, and we can have an alternate care site, and we can have a COVID clinic, and we can have a case management system and increased testing, and all of these things work together, then we're going to be able to ease those restrictions faster, because that spiral down car, that roller coaster ride is going to come down even faster. We're on the edge. Or maybe you can say we're on the precipice. But every time a first responder or a healthcare professional has to isolate, that takes away from our capacity. Every time everybody takes these unnecessary risks, it hurts us in the hospitals. And many people have contacted me. The only thing about being home is that I have more direct FaceTime with my iPad. And so that means I have more direct FaceTime with you, the citizens that are demanding, in no uncertain terms, some of you, that I open the beaches completely and that I lift the curfew. And of course, some feel the complete opposite way. And I ask all of you to consider that the idea of controlling the virus to be of the most important thing that we can do this summer, more important than any access road could give us. It can give us our freedom, not the freedom of a road, the freedom to live without the fear that this damn thing can kill you. I want to see it out of our community. I want to see it gone. I want to see our hospitals restored. I want to stop seeing doctors and medical assistants dying. I want to stop seeing our citizens dying. And if you really want to know what my justification is, that's it. That's it. There's no doubt the authority is there. But this is a data-driven decision. This is a decision based on your hospitals and your community of healthcare professionals saying this is the best thing for us, because you can't wish it away in 2 weeks. We've done well. And I asked you for a lookout point in 2 weeks to see if we can even do a little better. I know that we're still suffering because at 130 ICU patients, that spike is still way too high. And I believe that the best science says that if we keep up what we're doing, we're going to see these numbers drop. And I'm going to continue to monitor them, and I'm going to let data drive my decisions. By the way, that line, that data driving my decisions, is one that I heard Governor Abbott use time and time again with his team of medical professionals, and I like it, and I think it makes sense. And in the face of the evidence which says that we are doing what is working, it would be irresponsible for any public health official, and that's what I sit as right now as an emergency manager. It would be irresponsible for any public health official to relax any measures that are working. We can control the spread if we stay unified and together. We can add capacity to care for the infected. And I swear to my God that I am trying my best to do both. And all I can ask of you is to try to do your part, to have patience, and to understand. And in the next coming days, I'm going to try to put together on our website some empirical data that will help you understand this data that I talk about that's driving these decisions. Because there is real data and there is real knowledge that helps us make this decision to restrict in really the smallest sacrificial way a certain amount of road so that we can keep huge crowds from forming. And I know it's not perfect. I totally acknowledge. But I'll go back to what I said. We cannot be where we were at Memorial Day. We have to drive these numbers down. And you're doing it. We're doing it. And I want to see us keep it up. And I will pray alongside with you that in a few weeks, we will be able to ease those restrictions because we will be able to see these numbers decline and we will be able to offer other ways to create capacity so that we can relieve the burden that is inside our hospitals. So that's it for today. That's it for now. I'll see you again tomorrow via WebEx, and I look forward to your questions. And I thank you again for just being a part of what is, I think, everybody's wish these days, and that's just hanging in there together. Thank you.
Aún no hay cura para el COVID-19, tampoco hay vacuna, tampoco tenemos un tratamiento médico 100% efectivo, tenemos buenas y promisorios tratamientos como el del plasma. También podemos proporcionar oxígeno y otras medicinas disponibles para esto. Este verano ha sido muy difícil, el coronavirus atacó con fuerza y los casos se dispararon. Hay cosas que podemos hacer y seguir las órdenes del gobernador de usar cubrebocas y 50% de capacidad en los restaurantes ayuda. La orden de mi equipo de restringir el acceso vehicular también han ayudado. Ustedes han visto cómo estas medidas han ayudado a que los números sigan bajando. Tenemos muchas opciones con profesionales médicos de fuera de Texas que han venido a ayudarnos a crear una clínica de COVID-19 que ofrecerá otras alternativas. Allí contestaremos sus preguntas, ofreceremos opciones. Esto mejora nuestra capacidad de respuesta. Por favor, consideren que lo más importante para todos es combatir este virus. Voy a seguir monitoreando los datos y mis decisiones son basadas en ellos. Estos datos son reales para seguir luchando contra el virus.
Thank you, Judge. The good news out of her comments to me and the public today was that she got negative results and the rest of her county employees got negative results, and so that's great news. And we want to hope everyone that goes and gets tested gets the same great results, and that's negative. Not often do you want to find a negative, but in this one, a negative is good. So we'd open it up for questions if you have. I think, I can't see, but is the judge still on in case there's a question? Yes, Judge, are you still on?
So I'm here.
Okay. Questions for Annette or the judge or myself?
I have a question for
Annette, all right.
just looking for the question. Okay. Are there any ongoing nursing home outbreaks, and if so, what support, if any, is the health district giving in preventing or responding to them?
So the question is, are there any nursing home outbreaks? So we've been monitoring 15 nursing homes, and 12 of them recently have all had to be retested. This is really not unusual, to be honest with you, because we continue to see that they're following the governor's order. Anytime they have an employee or a resident that's positive, we do a STAR request basically for them, and then Health and Human Services, they send out a team. They come and they test them all, and they also help them to disinfect their facility. The nursing homes are working super hard. I'm just going to say that. They all have a plan. They're all doing their best to keep cases down. Recently, I saw one that had like 12 positives that came back. 11 were asymptomatic. One was symptomatic. They're all, in the same kind of area because they are still COVID positive, even though they have asymptomatic. The other thing that they're doing is they're utilizing their nurses that have had COVID-19, have tested positive, and now they're negative, and to minimize the risk of exposure to other nurses or nursing staff at that facility. So we are seeing this continued trend, but we've been fortunate that we have not seen, a lot of individuals or residents that have succumbed to the disease, but we're still monitoring it very closely. Thank you.
This is for the judge. Do I need to use the microphone still?
Judge, this question, speaking of that mic, can you hear the judge?
Judge Canales, can you hear me?
I'm ready. Yes, sir. You got me?
I'm hearing it barely. I don't know if we can get it cranked up.
Okay, how's that? Is that any better?
Okay, yeah, if you want to, ask your question. I think she can hear you, and then when
Okay.
she starts speaking, it'll come back.
Okay, Judge Canales, happy belated birthday, first off. And secondly, my story last night was about a petition on ipetitions.com that was asking you to reverse the beach closures order to let traffic come back onto the beaches, let people park on the beaches. Just wanted to see if you had any thoughts about that petition. That's, last I checked, about 1,600 signatures. Any thoughts on that?
Yes, I'm going to make sure you can hear me. Yes, my thoughts is that we were also, I have not been served yet, but I have noticed that the mayor and myself have been, are subjects to a lawsuit as well regarding very much the same issue regarding beach permits and a return of dollars as a result. And anytime there's any kind of litigation that sort of has the same type of subject matter that you would see in a petition, I just would say that this is the lawyer in me, but it's probably best not to comment on impending litigation, but I welcome the opportunity to have our day in court. I think that's what the law is for. And I think it's important that citizens have a right to speak. I welcome all perspectives and thoughts. And I think that, we need to air our grievances, and we need to also support our rationales for the orders that we create. I do believe that that's the best thing I can say about that situation. But I look forward to, to bringing it to the court of law where it belongs.
Okay, thank you. Any other questions? All right, well, I would want to remind you for your planning purposes for next week, we will begin to have these briefings just 2 days a week. They will be on Tuesdays and Fridays. And Friday's briefings will also include the reports from Texas A&M University, Texas A&M Corpus Christi. And so put that into your work schedule next week so that you don't show up here on Monday and you're all lonely. Because we'll be here Tuesday and Friday at 5 o'clock. And I'm assuming the Friday will be at 5. Sometimes they move them to 3 with A&M report, but I think they're 5. So Tuesday and Friday of next week, 5 o'clock. So that concludes the briefing today, and we appreciate it. Everyone stay safe. Judge, continue on and stay safe and stay healthy. And we'll see you tomorrow afternoon.